Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about chancroid. Chancroid is a highly contagious condition that is characterized by multiple ulcers in your private parts or the skin of the other parts of the body, usually due to infection by a bacterium called Haemophilus ducreyi. Haemophilus ducreyi enters your body through sexual intercourse with the infected person or through contact with the body fluids, especially fluids coming from the ulcers. The clinical presentation of chancroid is that after about 3 to 7 days post-exposure, after contact with the infected person, you're going to have small swellings that are going to develop in your private parts or on the skin of the other parts of the body. The skin that overlies these swellings is going to be reddened, and after some time you're going to form a single ulcer. But after some time you're going to have other swellings turning into ulcers, and so you're going to end up with multiple ulcers. The floors of these ulcers contain yellowish dead tissue as well as pus. There's a lot of pus coming out of the floors of these ulcers. And at this point, you're highly contagious, you're highly infectious. Please make sure that you don't have sexual intercourse with your partner, or don't touch the ulcers and then you touch other surfaces of your house, for example, or you touch the skin of your children. Make sure that you wash your hands with soap and water just in case you accidentally touch these ulcers. The ulcers are usually soft to touch. The floor and the edge of the ulcers are usually soft, and there is a lot of pain emanating from those ulcers. There's also an association of enlargement of the lymph nodes as well as swelling of the lymph nodes, and usually the lymph nodes also contain some pus. And when you touch the lymph nodes, especially in your groin region, they are usually warm when you touch them. Please make sure that you show up to the hospital, because when you don't come to the hospital, there is a possibility of transmitting the infection, especially when there is pus coming out of the ulcers. There is a possibility of transmitting the infection to your partner or to your children's skin, and then they'll get ulcers as well. They'll get the infection. It will not only prevent, coming to the hospital will not only prevent transmission to other people, but it will prevent complications. For example, soft tissue infections, a condition called suppurative lipodenitis. Coming to the hospital will also help you to shorten the duration of stay of the symptoms. For example, if you don't come to the hospital for treatment, the condition can even go on for like 3 months or even more. Please come to the hospital, because when you don't come for treatment, it can also predispose you to getting other infections. For example, HIV, syphilis, herpes simplex, and also lymphogranuloma venereum. These are just sexually transmitted infections that can result from you not seeking medical attention on time. The individuals that are commonly affected by chancroid include people that have multiple sexual partners, males who are not circumcised, the male gender, as well as the children and young adults in developing countries. The diagnosis of chancroid is essentially clinical, where we diagnose you with chancroid if you have one or multiple ulcers in your private parts that are painful, and you also have painful lymph nodes, especially in your groin region, that are also swollen. And also if you have negative results of syphilis, herpes simplex, and lymphogranuloma venereum, which are also sexually transmitted infections. When it comes to the treatment of chancroid, the following medications have shown to work: ceftriaxone, ciprofloxacin, erythromycin, and azithromycin. When it comes to the prevention of chancroid, I recommend that please let us all exercise sexual responsibility, accountability, and discipline. Please make sure that you have one sexual partner. Be faithful to your sexual partner and use condoms consistently and correctly. If you don't have a faithful partner yet, please abstain from sexual intercourse. And for the males, please get circumcised, because when you're not circumcised, you're prone to getting chancroid. And please, if you notice any ulcers in your private parts, please inform your partner. And if you have had sexual intercourse with them in the previous 10 days, let them be treated, and also please seek treatment. Please also exercise a good personal hygiene, and this entails making sure that when you touch your ulcers accidentally, don't touch other people before washing your hands with soap and water, because if you do that, you can easily transmit the infection to your children and those around you. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.